Welcome to the section on patient evaluation and the diagnostic investigation. The clinical evaluation is about more than just determining the right test. In fact, sometimes it's more important to first determine what test is right. While similar, these two statements have important differences that highlight the importance of considering our approach to the patient evaluation. One way to approach this case is to consider the right test and use the top three conditions on our differential to drive test ordering. The challenge with this approach is it tends to narrow our focus. We only test for conditions on our differential, and things that aren't on our differential may not be tested for. Another approach to this patient would be to consider which test is right. We could go back to our list of inflammatory, infectious, neoplastic, toxic, metabolic, inherited, vascular, and other conditions that affect the nervous system. We could look for tests which favor an inflammatory pathology or which make that less likely. For example, if we wanted to evaluate for an inflammatory condition, in the muscle, we could screen with the creatine kinase. Creatine kinase is highly likely to be elevated in inflammatory conditions of the muscle. If we're looking for inflammation in the neuromuscular junction, antibody testing can drive consideration of inflammatory condition, acetylcholine receptor, anti-MuSK antibodies, and others. In the nerve and central nervous system, we can use a lumbar puncture, demonstrating an albuminocytologic dissociation, elevated protein with normal cells, to suggest inflammation in either the nerve or central nervous system. And similarly, we could consider tests that favor an infectious, a neoplastic, a toxic metabolic, an inherited, vascular, and other types of pathology, and use this to broaden our focus. As you approach the page below, consider both sides of the screen. On the left, you will find common diagnostic investigations for patients presenting as our patient, and click through each to explore considerations around the types of testing you may consider. And on the right, consider your approach to the evaluation and how you might order tests to rule in or rule out, to favor or to lessen the likelihood of types of pathophysiologic processes. How would you use imaging? How would you use procedures? How might you use blood tests to favor certain pathology over others? Good luck. And remember, if you have a question, please ask using the button in the lower right-hand side of the page.